right, good morning, everybody, and thank you for joining us. Welcome to our webinar hosted by the Centre of Research Excellence on Achieving the Tobacco Endgame. My name is Shaniel Pulievich. I'm a Senior Research Fellow here in the Centre. Excuse me. And I'm delighted to welcome our presenter today, Ms Germaine Lai, who is a PhD candidate here in our Centre. Today, she will present on her very interesting and important research that aims to develop an evidence base to reduce tobacco smoke exposure in residential settings in Australia. This research has just been published in the journal Public Health Research and Practice, which is fantastic and especially impressive considering that Germaine only commenced her PhD a year ago and already has an article that's published. All right, thank you, Germaine, and over to you.
All right, thank you, Shaniel, for the introduction, and thank you everyone for joining today. My name is Germaine, and I'm a PhD candidate here at the School of Public Health at UQ. So before I begin, I would like to acknowledge the traditional owners and their custodianship of the lands which we are meeting today and doing this presentation, and pay my respects to their ancestors and their descendants who continue cultural and spiritual connections to country. I also recognize their valuable contributions to Australian and global society. So yeah, today I'll be talking about our scoping review on tobacco control interventions in subsidized housing. This paper was recently published in a special issue of the PHRP on collaborative partnerships for prevention, and it is actually a collaboration between the Tobacco Endgame CRE and also the Healthy Housing CRE. So I would also like to acknowledge the work of my amazing co-authors on this important review paper. Otherwise, we would not have been able to complete it so quickly. So I'll begin now. So tobacco smoking is a leading cause of preventable death globally and also a major driver of health inequity. Each year, about 8.7 million deaths are caused by smoking and about 1.3 are from secondhand smoke exposure. And while secondhand smoke exposure is a long-standing public health issue, the exposure that occurs in private spaces, such as homes, has been of increasing concern in the last decade. So smoking in or around homes not only affects those within the household, but also others in close proximity, especially in multi-unit dwellings. And monitoring studies have shown that secondhand smoke incursions occur in homes and common areas located adjacent to smoking household within multi-unit buildings, and common mitigation strategies such as opening windows, using fans, air purifiers, or ventilation system do not eliminate secondhand smoke. This poses significant health risks to those who are involuntarily exposed to secondhand smoke, including children, older residents, and also those with pre-existing health conditions. But why do we look at subsidized low-income housing? So firstly, people who are experiencing socioeconomic disadvantage have higher risk of tobacco-related harms than the overall population. Higher smoking prevalence is also associated with lower income, unemployment, and not owning a residential property, which are common eligibility criteria for subsidized housing, otherwise also known as social, public, or community housing in the Australian context. Several studies have also shown that subsidized housing residents are more likely to smoke than those living in other housing types. So, for example, there was one study conducted in England that found that adults living in social housing had 2 times the odds of smoking than adults living in other housing types. Most importantly, evidence has shown that secondhand smoke exposure is disproportionately concentrated among children, people living in subsidized housing, and homes being one of the key sources of secondhand smoke exposure for many people. So this is a smoke-free campaign ad by the UK Health Security Agency that I found recently, and I thought it was very nicely done with a very clear and short message. So I'll just show that now.
Over 80% of cigarette smoke is invisible. So no matter how careful you are, they still breathe in the harmful poisons. If you could see what's really there, you wouldn't smoke. Search Smoke Free now for your free smoke-free kit.
So what can be done to address secondhand smoke exposure in subsidized housing contexts? Article 8 of the WHO Framework Convention on Tobacco Control requires parties to the convention to implement smoke-free legislations to provide protection from secondhand smoke. So smoke-free legislation refers to the prohibition of smoking in specified areas, and they have been implemented in a range of public settings and demonstrated effectiveness in improving air quality and reducing secondhand smoke exposure. So unsurprisingly, there have also been proposals to expand smoke-free environments to include residential settings. And one of the examples is that in 2018, the US Department of Housing and Urban Development instituted a federal rule requiring all the public housing authorities to prohibit tobacco smoking inside the units, indoor common areas, and also within 25 feet of the buildings. And at the time of the review, this was the only nationally coordinated smoke-free housing policy and publicly managed subsidized housing. So if smoke-free legislations are effective and the US has already legislated a smoke-free housing policy in subsidized housing, why is everyone not implementing it widely? So now let's take a look at this video of when the US federal ban on smoking in public housing was implemented.
Huntsville's public housing is banning smoking starting Monday. The federal agency mandated everyone make that change in 2016. Thanks for joining us. I'm Dan Schaefer.
And I'm Demetria McClinton. Wave 31 Cindy Martin talked with people who live in public housing units in Huntsville. And as you can imagine, some shared very different answers.
And Demetria, on my phone is that no smoking agreement that anyone who lives in public housing in Huntsville must sign. It states that if you break the no smoking rules, you can get evicted from your home.
My wife and I are expecting and our first child, so she doesn't like to be around smoke, doesn't need to be around smoke. And I think it's going to be overall great for this area, this community here.
Wesley Hubbard was excited to hear about Huntsville Housing Authority's no smoking ordinance. Starting Monday, no one can smoke inside of any of Huntsville Housing Authority's homes. And you also can't smoke within 25 feet of any public housing entrances, administrative offices, or maintenance facilities. That's something Christina Briggs doesn't agree with.
Just don't make no sense to make people go 25 feet from the door. I mean, you're paying rent out here, so why do you have to go out of somewhere where you're paying rent at just to smoke?
But Hubbard thinks the new rules will make the housing nicer.
It definitely affects a lot when smoking is in the house. It affects the, obviously the smell, but it affects what it does to the walls, the cleanliness, and like I said, just the overall health for every family member.
The Huntsville Housing Authority also outlined the consequences if you break them. If you or anyone visiting your home violates them 3 times, you need to take a course or face eviction. After the 3rd time, the Housing Authority will evict you. Although Briggs doesn't agree with the rules, she knows to follow them.
That's just part of, we all have rules you gotta follow, so it's part of, you break the rule if you get caught.
The Huntsville Housing Public Authority is going non-smoking on Monday, one day before all public agencies are required to implement the rule. Live in Huntsville, Cindy Martin, Wave 31 News.
So as we can see from the interviews, there were mixed reactions to the federal ban. On one hand, there was a comment on how it did not make sense to not be allowed to smoke in your own home that you're paying for. But on the other hand, there were also views on how the policy will protect your family from secondhand smoke and improve the overall housing conditions and environment. But I think apart from these two opposing views on the policy, the news reporter also mentioned something important, which was that for those who break the rule, they could get evicted, which also, highlighted the risk of homelessness for residents who smoke. So given these ethical and practical challenges associated with smoke-free housing policies, we wanted to know what else has been done to address smoking and secondhand smoke exposure in subsidized housing contexts. So we conducted a scoping review to answer 3 main research questions. First, what types of tobacco control interventions have been implemented or evaluated in subsidized housing contexts? Second, to understand what has been the impact of these interventions on smoking and secondhand smoke exposure. And finally, what are the key research gaps on tobacco control interventions in subsidized housing contexts? We adhered to the JPI scoping review methodology as well as the PRISMA extension for scoping reviews, and we also pre-registered a research protocol in open science framework. For our inclusion criteria, we included both peer-reviewed original research and grey literature that detailed tobacco control interventions in subsidized housing. Interventions were defined as strategies aimed at reducing smoking or secondhand smoke, and subsidized housing was defined as rental housing for low-income households provided or subsidized by the government or related agency. Housing with healthcare services or that address specific care needs were excluded, and we also did not apply any publication date or language restrictions. We searched 5 different databases for peer-reviewed sources and used Google Advanced Search for grey literature, and we also used backward snowballing to identify additional studies. The included studies were charted according to the intervention type as well as the effects, and a post hoc decision was made to extract additional data on intervention acceptability and implementation experiences, as most of the studies actually included this as part of their results, especially for the smoke-free housing policies. So a summary of these results was reported in the paper itself, but the full results were provided as a separate supplementary material. And now I'll move on to our findings. So we identified about 11,500 sources, and after screening against the inclusion criteria, we included 53 peer-reviewed sources and 4 grey literature, so a final number of 57 sources. So what types of tobacco control interventions have been implemented or evaluated in subsidized housing contexts? We identified 3 main types of interventions. Firstly, smoke-free housing policies were the most common, with 32 studies evaluating this. And the policies were typically indoor smoking bans that prohibited tobacco smoking, not including vaping, with some variability in other provisions. So for example, most of them prohibited smoking in indoor and outdoor common areas, but there was some variation in how outdoor areas were defined. Most of them prohibited tobacco smoking only, but one study did specify that both tobacco and cannabis smoking were prohibited. Unsurprisingly, most of the studies were implemented in the US because of the federal ban, with only 2 from Canada. Next, there were 19 sources on cessation-focused interventions. So these are interventions that specifically targeted smoking cessation using a range of strategies. So for example, maybe it's usually an on-site intervention with behavioral counseling and pharmacotherapy provided, as well as cessation support. And the intervention components varied across the studies, but all of them were aimed at targeting smoking cessation. Again, majority of the studies were implemented in US subsidized housing, with only 1 from the UK. And finally, there were also a small number of interventions that were not directly targeting smoking, and these were evaluated in the US context as well, with only 1 from Singapore. So I'll not be going through this, but this is a table in the paper that includes more detail about the different policies and locations if you would like more information. And this is another table in the paper of the different components used across the cessation-focused interventions. So the ones that I didn't mention also includes smoking cessation educational resources, and some also included environmental changes. Now I will move on to the more important part, which is the results for our second research question on the impact of these interventions on smoking and secondhand smoke exposure. In the paper, we also reported some findings on the availability of cessation support and health impacts, but today I will only be sharing the overall and key findings for smoking and secondhand smoke exposure, as well as the implementation experiences for smoke-free housing policies. So for smoke-free housing policies, 9 studies evaluated the impact on smoking behaviors, and most of them were repeated cross-sectional analysis or used self-reported measures. All of the studies found positive short-term and longer-term changes to smoking behavior, although not all of the findings were statistically significant. So, for example, they found reduced cigarette consumption, increased quitting, quit attempts, or quit intentions. However, there was uncertainty on the long-term effects, as only one study measured outcomes up to 2 years post-policy. One study did actually investigate the effect of the US smoke-free housing policy on e-cigarette initiation among people who smoke tobacco, and they did not find evidence for increased initiation rate. Next, 13 studies looked at the impact on secondhand smoke, and most of them measured indoor air quality, so for example, airborne nicotine and fine particulate matter levels, or used self-reported exposure. Overall, there were mixed findings. Even though there were reductions in secondhand smoke exposure, there were also differences in terms of the magnitude or direction of the change. So, for example, some studies might find decreased indoor secondhand smoke exposure, but not for the outdoor areas, or they found decreased secondhand smoke levels in the outdoor areas, but maybe in a different direction indoors. So this suggests that maybe there are some potential changes in smoking behavior. So people are just, changing their smoking behavior and smoking in different places. Some of the studies also did not find significant differences between housings with or without smoke-free housing policies. So although secondhand smoke levels may have decreased when they compared to control housing, it wasn't a significant difference. One study also did find that while secondhand smoke levels decreased within the first month, they actually returned close to baseline levels 12 months later. So once again, there is uncertainty on long-term adherence to the policy. Maybe when the policy was first implemented, people were adhering to it, but subsequently, maybe not so much. So 8 studies examined policy support and 18 looked at implementation experiences. Overall, resident support was high for the policies, ranging from 50% to 89% across the studies. And this was especially among those who did not smoke. However, support tended to be lower among those who smoked. So, for example, in one study, 30% of the residents who smoked supported the policy, but an overwhelming 92% of those who has never smoked supported the policy. One study also reported higher support for common area smoking bans, but for in-home and outdoor, it was lower. Policy enforcement strategies range from verbal or written warnings, violation notices, fines, and less commonly eviction. However, several studies also reported enforcement and compliance issues despite having these strategies. So, for example, residents reported a lack of enforcement by the staff, and they also described discomfort with confronting their neighbors who were smoking. And housing staff themselves also raised practicality concerns with monitoring in-home smoking. So there's kind of this sense of not knowing who is enforcing it and how to enforce it. There were also reported unintended outcomes, including vandalism, damaged smoke alarms or air monitoring devices, likely because residents wanted to smoke undetected. Next, I'll move on to the cessation-focused interventions. So about 10 studies looked at the impact on smoking behaviors, and some were cluster randomized controlled trials that compared intervention effects with a control group that did not receive an intervention. Once again, all of them found positive short-term and longer-term changes to smoking behavior, although 2 studies that did a comparison did not find significant changes when compared to a control. Also, again, no studies investigated effects beyond 12 months, being that these interventions tend to be a short-term program that was delivered on site. For implementation experiences, 6 studies looked at this, and this included examining participant experiences as well as the implementation strategies that were used. So from the qualitative findings, we reviewed that participants described the interventions to be fun and very effective, and they particularly liked when there were peer-led or group sessions, as the participants described it as a good experience that allowed them to learn from others, and they also spoke very favorably of the support received from peers who are also trying to quit smoking. Where NRT was provided, it was viewed as helpful by the participants, but some also reported difficulties with NRT use. So, for example, in one study, I think about 5% of the participants reported experiencing some side effects. Some of them just simply did not like it. And in one study, they actually found that less than 20% of the participants were using the NRT gum correctly at the first follow-up visit. Only one study reported participation rates. So it was somewhat low, about half in the cessation program. So these are like a component of the intervention, smoking cessation counseling session, for example, and only about a 50% retention rate of the peer mentors used. Next are the other types of interventions that were not directly targeting smoking, but they reported effects on smoking-related outcomes, so we decided to include them. So, for example, some of the studies looked at building renovations. One was on just a general health screening intervention. One was related to a rental housing program, and one estimated cost savings associated with prohibiting smoking in US public housing. So I'll only be briefly going through the ones that look at building renovations. And these studies found minimal effectiveness on reducing secondhand smoke exposure. For example, one was a simulation modeling study, and they found decreased secondhand smoke infiltration following building renovations to improve, say, building ventilation. But the magnitude and direction of the change was also influenced by the season, location to a smoking unit, as well as resident behavior. So while there were some changes, there was just too much variability, and it simply cannot completely eliminate secondhand smoke. Finally, on our third research question on research gaps identified by the authors of our reviewed studies. Most of the recommendations were related to smoke-free housing policies. So, for example, given that the findings reviewed various enforcement challenges, there were recommendations to explore the tension between enforcing smoke-free housing policies and achieving public health goals, and also to investigate the factors which may impact compliance with the policies. There were also recommendations to develop community-tailored strategies to minimize the unintended consequences of the policies. And more broadly, in the development and implementation of any interventions, there were also recommendations to take into account the affordability of pharmacotherapy products such as NRT for the residents, and to explore providing free or subsidized products. Finally, as subsidized housing residents often have limited housing options or may move around different subsidized housing complexes. Therefore, authors also recommended continued monitoring of residents' transitions within and out of subsidized housing to ensure that residents are not at increased risk of homelessness, and also continue to receive support from the interventions if they were just moving from one public housing building to another one. So to summarize, overall, our evidence suggests that having something is probably better than nothing. Interventions delivered to subsidized housing residents can increase smoking cessation, reduce secondhand smoke exposure, and the implementation experiences also indicate that there was resident support or acceptability of the interventions. However, there are still ethical and practical challenges that need to be addressed, especially for smoke-free housing policies. While the right to smoke in one's home is asserted by some, the right of people to smoke-free air in their own homes must also be considered, particularly for those with limited housing options. Although from a public health perspective, the collective benefits of a reduced health burden may outweigh concerns about limiting individual autonomy from telling them, you can't smoke in your own home. This ethical tension should still be considered in the context of prevailing social and cultural norms. Our findings actually also suggest that support for and adherence to the smoke-free housing policies could actually be improved with more engagement with the residents and through providing cessation support. So where do we go from here? These are just some of the key takeaways from the paper. So we think that comprehensive smoke-free interventions in subsidized housing provide an important opportunity to address health disparities. And most importantly, in addition to these ethical concerns that are associated with smoke-free housing policies, enforcement challenges can and should be addressed to increase resident support and compliance. Future research should also employ rigorous evaluation approaches to ascertain both the short-term and longer-term impacts of the interventions and develop tailored implementation strategies across varied subsidized housing contexts. And that is all from me today. If you'd like to read more about the paper, I have a QR code up there. And I'll hand over back to Chanel.
Wonderful. Thank you so much, Germaine. That was so interesting and such a great presentation. If anyone has any questions for Germaine, please can you put them in the Q&A function, the box thing is at the bottom of the screen. I have a question. I was wondering if you have any suggestions. How would you improve residents' acceptability of these policies?
Thank you, Chanel, for the question. It's a very good question and one that I think all practitioners and researchers should think about as we are developing and implementing the interventions of policies. So from our findings, there were actually quite a lot of findings that suggest that where there were sustained resident engagement, so not just having any form of engagement, but actually from the pre-policy stage up until implementation to continuously involve the resident, that actually increases resident support for the policy. So it's not that suddenly you implement something and then the residents get a shock like, okay, now I can't smoke, what to do. So there is one suggestion that I think is important. And the next one I think is to ensuring that the residents have access to cessation resources to help them with the transition from being able to smoke in their housing area to not being able to smoke. So at the same time, from our findings, we did find studies that reported that where there are cessation services provided, so for example, if there was free pharmacotherapy that were provided, residents are actually more likely to quit smoking, and they actually expressed that they do want these resources, but it was not available. So I think these two are very important in terms of encouraging residents' acceptability and compliance.
Yeah, absolutely. That makes complete sense. I know various forms of pharmacotherapy have varying levels of support, so it would be interesting to see if there's any particular kind of pharmacotherapy or other kind of cessation interventions that would be particularly accepted and effective among this population. I'm sure you're looking at that.
Yeah.
Does anyone else have any questions for Germaine? All right, it doesn't look like it, but I encourage everyone. One just popped up. Here we go. We have one from Ara. After the scoping review, could you please briefly outline what you will be working on in your PhD in the Australian context?
Yeah, okay. Thank you, Ara, for the question. There are actually a few studies that I'll be looking. So the first few would be so I will actually have two upcoming studies to understand more in the Australian housing context. So we want to know how the situation is like from both the perspectives of people who are experiencing secondhand smoke exposure, as well as those who are managing the issue, and as well as those who are just living in public housing. So we'll explore through two studies. One would be a stakeholder interview study, where we will be recruiting people who represent these different areas to hear from their views what is the situation is like, how are they handling it. And there will also be another study whereby I will be collating a database of complaints from, for example, local cancer council or state health departments to see what are the general themes in these complaints that people are sending in, whether the issue is more, say, concentrated in a particular housing type, or just in general, if people have any suggestions or views towards any types of policies or interventions that could help address the issue. And another one that I'll be working on is to look at how this issue is framed in the media. As we all know, with all kinds of policy, the media can influence how our public perceptions of the policy, and this one in particular, when we are talking about smoking regulations and housing, is particularly contentious. So it'll be interesting to see over the last 10 years how it has been framed and how that might have changed, to sort of get an indication of what is the discourse like in the media.
Amazing. That sounds so interesting. I think it'll be a lot of fun reading through the complaints. Okay, well, thank you all very much for joining us, and a huge thank you to Germaine for her presentation. It was very interesting. I encourage everyone to go and have a read of the publication and share it with your networks. Make sure you cite it in your research, and please reach out to Germaine if you do have any more questions about her research. Thank you all and have a great day.
Thanks, everyone.